Okay, hi, it's Dr. Buford. We're just getting started on your right shoulder. We're looking at from the back to the front. Everything you see is magnified 30 or 40 times on the screen. What we're shaving here, just so we can see a little bit better, is actually part of the rotator cuff tear. Your biceps tendon is right here, but you can see the torn rotator cuff is all this area on the left side and at the top of the screen here. The camera's coming in from the back of your shoulder, and the shaver that you see here is coming in from the front. So right now we're just cleaning off where the rotator cuff tendon normally inserts into the bone. And then in just a minute we're going to show you how we fix that, but we still got a little bit of work to do inside the joint before we get there. Okay, so here's your biceps. It's got some fraying in it, as you see there. And as we look at the insertion, it's got some fraying down here as well. These are mostly degenerative changes. We're going to rotate and look towards the back of your shoulder here. This anatomy looks okay. There's really not much arthritis in the actual joint. That's good news. In the front of your shoulder, this anatomy looks normal. A little bit of fraying on the superior edge of the subscapularis tendon right there, but that's not too bad. So we're going to get to work on the biceps tendon, and then we'll show you what we do for the rotator cuff. I'll show you we've released the biceps tendon. There's the edge of it there. See how it retracts back when we pull on it. And now we're going to go ahead and get to work on the rotator cuff. To do that, we're going to change positions with your shoulder. Okay, so here's the tear in the tendon. The anterior or front of the tear is on the right, so your biceps tendon is going to be up there if you keep looking and lifting. Your biceps tendon will show up eventually. Here to the left, this is the posterior aspect of the tear. We're going to place a suture anchor in the bone. This is the joint. As we lift up here, that would be down into the joint. If you look in there, you can see the glenoid down there. That's the socket. And so we're going to try and cover up this hole that you see, this whole area right here. And so we're going to start at the articular margin and count back about 4 millimeters, which the entire footprint comes all the way out to here. We don't want to put our anchors way over here. You can put them right at the articular margin, and we know that the cuff will heal all the way back. I prefer to put them about halfway or maybe a little bit closer to the articular side, but somewhere right in this region is a pretty good spot so that we can maximize our healing of this tendon back to the bone. So we'll go ahead and show you the guide in just a minute. Okay, so it took 4 stitches to repair the tendon, but we've got that hole completely covered up, as you see. We used 2 anchors. First stitch way back there. And so now that's fully repaired. One of our little tricks is we found that by making some little holes in the bone, it releases some of the marrow elements. So before we do that, let's go ahead and, well, we can do it now, we've got it. We're going to still tie the sutures for the biceps tendon. Tap that down. A little more. Okay. So again, these holes are just to let out some of the bone marrow elements that have stem cells and other things that help things heal. Okay. Crochet hook. Now we're going to reach across and get the bicep sutures and tie those. We'll show you some more in just a minute. Okay, now we're all done. The final suture, way in the front, is the bicep suture. It's that one right there. And then everything else is for the rotator cuff. So you can see the first blue and white one, that's the biceps tenodesis suture. Cuff looks great up here, there's no tearing. Then we get into the sutures for the rotator cuff repair. There's 1, 2, 3, before, and you can look at the bone and you can see that hole that you had is completely covered over. Okay, so I'm happy with the way that looks. Almost a mini double row repair, but that looks good. We're going to finish up and get you back to the recovery room shortly. Good luck to you now. Okay, so here you can see, as we turn down the pressure, you can see the bone marrow elements start to come out, and they just kind of coat the repair. My old mentor calls that a crimson duvet, and that's what we've done. We've given you a little crimson duvet there to help things heal. Bye-bye now.